This is Dr. Linda Snetselaar from the University of Iowa. I am the editor-in-chief of the Journal of the Academy of Nutrition and Dietetics, and our podcast today is on the validation of dietary instruments. And I have with me Dr. Sharon Kirkpatrick, who is an associate professor at the School of Public Health and Health Systems at the University of Waterloo, Ontario, Canada. And I'm going to be talking with her about the concept of the importance of validation of dietary instruments, and shortly there will be actually 2 articles in our journal that are related to validation. And so she is the perfect person to be talking about that particular topic this morning. So to begin, Sharon, I wondered if I might ask a very important question. Why is the validation of dietary instruments vital to what we do in our research?
Thanks, Linda. I'm really glad to join you and talk about this topic today. So validation is critically important in dietary assessment because the robustness of the findings of any study really rely upon how valid the instruments that we use are. And so validity broadly refers to whether a measure is suitable for a given purpose in a given context, or we might otherwise think of it as the extent to which it captures the construct it's intended to. Within the realm of dietary assessment, that construct could be intake of protein or added sugars, for example. So to think of an example, if we're reporting on children's sugary beverage consumption, we want to know that the instrument we use did a reasonable job capturing that consumption. We also want to be able to interpret our findings knowing the limitations of the instruments we used. For example, intake of sugary beverages might be somewhat underestimated because we know that there are social desirability biases that impact reporting. Validation is also very important because understanding errors in our instruments can help us to develop strategies to mitigate it. For example, from prior validation studies, we've learned about error in ways that have prompted the development of new technology-enabled tools that help us to reduce error in data, and we've also learned or were prompted to develop statistical approaches to help mitigate error. I think overall, given the high level of interest in dietary risk factors, we know that they're among top contributors to morbidity and mortality globally. Validation is really critical for helping to ensure we're using the best possible instruments in our research, and also that we're implementing them properly and interpreting the resulting data appropriately. And broadly, this can help us to inform policies and programs to support healthy eating.
Thank you, Sharon. We receive a lot of articles as submissions to our journal, and often there are instruments that are in the process of being validated or might need to be validated, so that everything you're talking about, I think, is really critically important to scientific rigor in terms of many of the articles that we're receiving for our journal. When you think about major challenges, what are some of those as people begin to validate a dietary measure?
So I think one thing is to keep in mind that there are different types of validity, and these all work together to give us a big picture in terms of, again, how suitable our measure is or our instrument is for a given purpose. And early on in the process, for example, we might collect feedback from members of our target group or from experts to assess space and content validity. And those, while they can be challenging in themselves, really the major challenge is when we get to the next step and we want to be able to compare our instrument to truth. We want to be able to look at how well does our instrument do in terms of capturing true intake. And this is very challenging because we have very few markers of true intake within the realm of dietary assessment, and those markers of true intake that we do have tend to be burdensome and really not feasible for most studies. As a result of this, we're often comparing our instrument that we wish to validate against another self-report instrument. Of course, self-report instruments provide us with valuable information, but we also know that they are affected by error. The data that they capture are affected by error. This error could come about due to recall biases or socially desirable reporting, for example. And so when we're comparing our two self-report instruments, we need to keep in mind that they're both affected by error. And this is important because it's not only true intake that could be correlated, but also errors in our two measures that could be correlated. So if we look at something like a correlation coefficient, it might be inflated as a result of that correlated error. I think another challenge is that a number of different terms are used in the literature, and so it can be confusing. It can be difficult as you are setting upon a validation study to determine what the most appropriate procedures to use are and how to interpret your data. And I think hopefully the two papers that you mentioned will help us to begin to link together the different concepts that we're using, figure out whether we're using them synonymously, and what we really mean when we're talking about the validity of a measure.
I think it's important to, just as you have, identify the fact that there will be two really extremely important papers published in our journal relatively soon. And I wondered if you might talk just a little bit about some of the key elements that we need to consider as we look at validation methods.
Sure. So specific to dietary assessment instruments, of course, the first step is knowing what the instrument is that we're trying to validate. But beyond that, we also really need to think about what particular dietary constructs and also the target groups and settings. When we're validating an instrument, we're really validating it, again, for a particular purpose. It's the data that we're collecting for that dietary construct in a given population or setting, not the method itself that we're validating in some way. And we know that dietary intake and diet patterns are very complex. We eat and drink many different foods, and so we need to know what is it that we're trying to capture with this instrument and what is it that we're trying to validate. As well, dietary patterns differ across populations and across contexts. So one tool might do a pretty good job of capturing something like fruit and vegetable intake in adults, but not do a very good job, for example, in young children. So it's very critical that we clearly identify what we're trying to capture and among whom and in what settings. Second, again, we're often comparing a measure, our instrument to be validated, to another measure. And we need to be very explicit about the measure, the reference measure selected, the one that we're comparing to, and why we selected that one. This is really important since that measure is being used as a reference to judge how well the instrument being validated performs. And then we need to know how well that reference measure itself performs. Has that measure been validated? Again, in what populations and settings? We also should be upfront about what we can learn from this comparison. Again, if we're comparing two self-report tools to one another, what is it that this comparison can tell us, given that the error as well as truth might be correlated? I think one more thing to point out is that validity is not black and white. It exists on a continuum. And so it's important to consider ahead of time, what do we really expect in terms of the performance of an instrument? Again, when we're talking about self-report, it's not going to be 100% valid. It might be highly valid for particular diet components, but not others.
Okay, thank you. Very, very important ideas. One of the things, too, that often comes up in terms of articles that our journal might receive is that there are things that may be forgotten as someone is working through a validation process. And I wondered if you could identify some points that researchers often forget, so that maybe there are a few things to identify, and those kinds of key points might indeed be helpful as someone is writing an article.
Mm-hmm. So we've already spoken quite a bit about the dietary constructs, the populations, the settings. Beyond that, another issue is the timing, the time frame to which an instrument pertains. So, for example, the instrument that we're validating might capture intake over a long period, such as a month. whereas the reference measure that we're comparing it to might capture intake over a shorter period of time. Maybe it's a couple days in the case of something like a recall. And thinking about this issue ahead of time can help us to design our study so that we can be as insightful as possible. So, for example, we need to think about whether we need repeat measures of our reference measure and at what time intervals. And that, for example, again, thinking about the issues with a 24-hour recall and comparing that to a longer-term measure, if we have repeat administrations of our 24-hour recalls, we can then use statistical procedures to estimate usual intake over the same time frame to which our measure to be validated pertains. And that way, we're comparing apples and apples in some ways. If we're trying to compare with different time frames, it's going to make our comparisons very difficult to interpret. I think, again, I've already mentioned statistical tests, but thinking about the tests that will be conducted early on to address the question that's being asked by the validation, I think would help researchers to, again, ensure that the data they collect can actually help them to answer their questions, and to think about, again, what they are expecting to see in terms of the instrument's performance. Thinking about whether multiple tests will provide a stronger understanding, and also in some cases it might be important to determine in advance or a priori how the results of a particular test will be interpreted. So, for example, in some cases, researchers use cut points to determine whether a given value suggests a tool is valid or not. And thinking early on, are those cut points reasonable? And again, keeping in mind that validity exists on a continuum rather than being a yes-no type of property.
Okay, wonderful. I also know that when we look at manuscripts, we are often looking at a manuscript that might have a piece in it that's very much focused on validation. And I was wondering if you could just tell us a bit about what should be included in terms of key components when describing a validation process in a manuscript.
That's a really good question. As with any study, we need to know some of the basic details, such as who was in the sample and how they were recruited. And with respect to the validation in particular, we need to have a clear description of the instrument that's being validated and a very clear description of the reference measure to which that instrument was compared. We also need a justification for that reference measure, and this could include, for example, how that measure itself has been validated in prior studies and for what dietary constructs. Additionally, researchers should provide information that helps other researchers to determine whether the tool or instrument is suitable for their purposes. So, for example, in cases in which researchers can compare against a measure of true intake, like biomarkers or observation, when we know about the extent of error in an instrument, we actually can use that information to inform our sample size calculations because we know that error results in power loss. So going beyond just stating that a tool has reasonable validity for this dietary construct or that dietary construct to really provide interpretations for other researchers, I think can help move the field forward. As well, using all evidence collected. So if there were comparisons to multiple reference instruments or the comparison with a reference instrument was preceded by face and content validity, perhaps construct validity, we want to know what all of the evidence is telling us about the suitability of this measure. I think just to add to that as well, going beyond the validation study itself and thinking about all of us who are using instruments in our studies, it's also important that when we report on the measures we're using, that we provide information about their validation. And I know with tight word counts, often we simply state that we're using previously validated measures. However, that really doesn't tell our readers very much, again, in terms of how suitable that measure was for our research question.
Thank you, Sharon. That is incredibly helpful. And I can already see ways in which authors might be able to use everything that you have been talking about today to actually design a manuscript that will really hit all those key areas relative to validation. So thank you so much for being with us today on the podcast. And we also appreciate the fact that we will soon be seeing 2 articles that you were a part of, one in which you are first author. And the hope is that all of that information will contribute to scientific rigor in terms of the manuscripts that are published in our journal. So thank you so much, Sharon.
Thank you for having me and also for supporting work in this area.
Thank you.